was once a TB victim, but I'm also positive and I'm on ART treatment. It was very hard for me. I could not eat any hard stuff. It was only the fluid, and I could not walk. I could not visit the toilets. Nothing was working. It was until I came here, the lighthouse, where they did the scanning, when they detected that it was TB and not cancer.
When our team saw them and we scanned them together, we said at that time, no, you don't need to be operated, you need TB treatment. And basically, after 2 months, he said, thank you, you did the right thing, it was TB.
For Lighthouse, we call ourselves the hub of advanced HIV disease. And for us to implement a very successful HD, it needs equipment, it needs expertise.
I'm a German-trained internal medicine and infectious disease physician. Worked in KwaZulu-Natal in South Africa, which was at that time the epicenter of the HIV-TB pandemic. And so that always made me interested in HIV-TB care. 2016, I joined the Lighthouse clinical advisor here, trying to mentor the clinical staff to improve quality and get the best care that's possible with the resources and the situation we have.
So I've worked in the HIV program for over 25 years, seeing patients with HIV. We are blessed that we have Dr. Tom Heller, who has been writing several books. So we have got Lighthouse Manual for the patient management. So in these manuals, we have different cases on how to manage different conditions.
We also organized courses for the Ministry of Health, radiographers in the district hospitals. For example, the FASH scan as a diagnostic tool, it's part of the Malawi National TB Guidelines. Lighthouse is spearheading the technology. And I mean, quite a good few of the clinicians that we trained are now trainers themselves. About 30% of the patients who are admitted are HIV positive, and a lot of them have advanced HIV disease. And of course, for these patients, you need to be quick. They are sick, they have a high probability to die. Ultrasound is one of the tests that is done on the bedside and that rapidly helps to diagnose, for example, TB. There is tests for cryptococcal meningitis, for TB.
With the elastography that is inbuilt in this new machine, now we can see how stiff the liver is, because that's also another marker of treatment eligibility, and that's how also Mindray is coming in to kind of boost that position that Lighthouse has as a center of excellence to integrate hepatitis B into the national HIV program, or we can just call it as an infectious diseases unit.
I never had any hope, but after visiting the Lighthouse, they injected this layer of hope in me, and here I am now, strong and sound.
After working the full day, I go home and sit on the chair. I try to recall, what did I do for that recipient of care? Did I do the right thing? Or I need to improve? Because at the end of the day, this recipient of care will come back to us, saying, you guys helped me.
It's nothing more rewarding than getting a diagnosis, getting the treatment right, seeing your patient getting better, and he comes back and says, thank you. And of course, that is where the ultrasound helps indeed.
Our overall goal is to bring in that promptness and also capacitate other districts through the referral program so that they are able to identify these cases. If they cannot manage, send them to us so that we manage them and then we send them back to their homes healthy.